Good evening, everyone. My name's Louise Harger, and as Chairman of High Cancer Care, it's my honour and privilege to welcome you to this evening's Nutrition and Wellness Seminar. We are delighted to have so many tuned in. We were a bit worried, we thought maybe everyone is zoomed out, but it seems not by the numbers who are interested and who have joined us. I did ask earlier the presenters that I am now possibly in a more mature range, if there might be anything of interest for me. And I've been assured that I should absolutely stay tuned in, and I will definitely benefit too. So I'm very much looking forward. As I say, it's never too late to learn. So it gives me great pleasure to welcome Dr. Naomi Potter, who is a specialist menopause doctor and holds the British Menopause Society Advanced Certificate in Menopause Care, and is a British Menopause Society approved specialist. She worked in the NHS for 16 years as a GP, with a specialist interest in menopause and women's health for 9 years. Dr. Potter now works solely as a specialist in menopause care, providing holistic menopause management.
Yeah. So I think I will just start. Thank you, Louise, for that brief introduction, but we'll start. And thank you for inviting us this evening to talk about nutrition, wellness, and of course, hormones. So we're going to start this evening by talking to Dr. Naomi Potter. Thank you for joining us, Naomi. I hope you can hear me okay.
I can hear you perfectly. Yeah. No, thank you for inviting me. Yeah, all good.
Great. So let's start some questions for you, Naomi. So many women associate menopause with women in their 50s. What is the average age that you see in your clinic? And can you explain the difference between perimenopause and menopause?
So I see women from all ages because it's possible to go through the menopause when you're a teenager. So I see women in literally every decade of life. The average age for a woman to go into the menopause is 51, but that really just means when her periods stop. It doesn't necessarily mean when symptoms start, and symptoms typically start early 40s to mid 40s normally. So I suppose the typical age of patients in my clinic would be early to mid to late 40s, something like that, with a sprinkling of women much, much older and much, much younger and everything in between.
Yeah.
You said there was another part of the question. You have to remind me.
The difference between perimenopause and menopause.
So you don't go through the menopause, you kind of go into it. So it's really your body becoming increasingly estrogen deficient as we get older and our ovaries stop working so well. So the perimenopause is the time where hormones are very turbulent. It's typically in the 40s, but it can be much earlier. And it's characterized by you normally still have periods, but you can have turbulent symptoms that come and go. And then you are considered to be postmenopausal from a year after your last period. So it's a kind of retrospective diagnosis. You can't know you're menopausal until you've been a year menopausal, if you see what I mean.
Yeah.
Thank you. Hi, Naomi.
Hi.
So there are some main symptoms that are associated with menopause. Could you just run through some of those with us?
So there are the kind of typical symptoms that everybody or most people know about, which is things like hot flushes, night sweats, periods changing or periods stopping. They're not necessarily even the most common symptoms. Because you have estrogen receptors everywhere, then you can really get perimenopause and menopause symptoms anywhere. And symptoms vary from woman to woman, but they also vary over time for individuals. So they may have a few months worth of one symptom and that might change to another, and that might change to another. And so they can just literally be anything from, that would affect anything from the top of your head to the tips of your toes. Literally most things can be attributable to the menopause. I call it the master of disguise because a lot of women end up with referrals to see all sorts of specialists when actually it's estrogen deficiency that's their issue.
So what would you say are the most common symptoms that you see with your patients?
Well, I think I get a slightly kind of skewed sample because I get patients who haven't had much luck going to their GPs. So perhaps GPs haven't recognised their symptoms as being menopausal. But anxiety, I suppose, is the number one. And I get a lot of patients coming to me saying, I'm really, really anxious, never been anxious before. I don't know what's wrong with me. Am I going mad? Another one is memory problems and word finding difficulties and poor concentration. And a lot of women worry that they have early onset Alzheimer's or dementia. And that's often attributable to menopause. So I suppose those are the two symptoms that bring women really concerned. And I probably see more than you would necessarily in general practice because it's a less well-recognised symptom.
Yeah. So what about some of the lesser known symptoms in relation to menopause? I know you said it could be head to toe, but
yeah, so I think there's about 64 different menopause symptoms. We're counting, kind of it increases all the time. So things like tinnitus, dry eyes, palpitations, burning tongue, joint pains, muscle aches, weight gain, itch, hot feet, cold flashes, urinary tract infections, skin changes, hair loss. Those are the kind of more unusual ones that a lot of women have never heard of. I suppose those are the lesser known ones.
I think it's the joint pains that often kind of people miss, and they just think, as we age, we kind of should be feeling like that. But, we have had clients that have kind of been walking down the stairs sideways because their calves are aching, and it's those aches and pains that often do kind of get misdiagnosed. So we know that there is a lot of misdiagnosing going on. So what do you often hear from your patients in terms of their experiences with this? So I know we've covered the Alzheimer's, kind of the forgetfulness.
They can end up going off down kind of rabbit holes of investigations, and sometimes investigations are totally appropriate. So if you've got palpitations and shortness of breath, it is totally appropriate that you are investigated from a heart point of view, without a shadow of a doubt. But often these women come back with nothing found, and then they're a bit lost because they've got horrible symptoms, their palpitations waking them up in the middle of the night, feeling breathless with it. And they're a bit stuck because they haven't got a diagnosis. There's nothing to treat them with. And the same thing can happen with patients that go off to see orthopaedic doctors or rheumatologists with crippling joint pain, muscle pains, bodies kind of seizing up, which then has that the double whammy effect of meaning that they then can't exercise, so they can't keep mobile, so they can't keep slim, and then that makes things even worse. So it's just about unpicking it and finding somebody that comes to the diagnosis, and then they are treated accordingly, but also it kind of empowers women to know what's wrong with them, and then they can know what they can do to help themselves.
Brilliant, thank you.
Yeah. So in terms of just misdiagnosis, I know that Lauren and I find with some clients that they're sort of prescribed antidepressants, for example. Do you often come across that in your clinic, and actually it's menopause? It's
very often.
Yeah.
Antidepressants kind of they have a role in medicine for sure. They're not kind of they're not evil or anything like that. They're good drugs. But the problem is that the first line treatment for menopause, if in a woman that can take HRT, is HRT. It isn't antidepressants. Antidepressants will treat particular symptoms, but they won't treat the estrogen deficiency, and there can be very unpleasant side effects associated with them in some women, and it's just not the right treatment. But if you go to your GP in your early 40s with anxiety or low mood, then a lot of GPs aren't trained to think, oh, 1 minute, could this be hormonal? And they're used to prescribing antidepressants, and so they get put on antidepressants rather than looking for the true cause.
Yeah. So in terms of blood tests or tests that you would carry out, what would be appropriate to do in terms of menopause?
So it depends. If you are a woman over the age of 45 and you have typical symptoms, nothing, no suspicion of anything else going on, you don't need blood tests to make the diagnosis. The chances are you are estrogen deficient, and that that you are perimenopausal. So you don't need blood tests to confirm it. Sometimes, if you are suspicious as a doctor that something else is going on, particularly things like thyroid or vitamin D deficiency, it's worth doing some blood tests, to exclude those causes. But often bloods will come back normal. Firstly, because the lab normal range is enormous, and secondly, because it's just a pinpoint in time, and certain hormones fluctuate so much that you never quite know what you're going to get when you do the blood test. They can be useful in monitoring absorption of HRT or monitoring somebody's progress on it, or whether or not you're going to give testosterone, but that's a bit more specialist. It's not what you would expect a GP to necessarily do. In women under the age of 45, then it is useful to do bloods, and that's what the guidelines say, is do some blood tests, particularly early on in the cycle, to have a look to see what hormones are doing, and also, again, to exclude other causes. But one of the important things to remember is that normal bloods shouldn't mean that you don't treat if treatment is appropriate. So that's one of the worrying things, is that women who are really suffering have normal bloods done, and whoever's interpreted them may not have interpreted them correctly, or even if they have been interpreted correctly, because they're in the normal range, they're dismissed, and the kind of appropriate routes aren't followed. So you just need to be a bit careful with bloods.
Yeah, I think that's a really interesting point. I mean, there's so much fluctuation, isn't there, in the hormones from day to day, minute to minute. Can you just explain a bit more that, it can be one thing one day and completely different the next?
Yeah, absolutely. And cycle to cycle, it's different. So your menstrual cycle is governed by a number of different hormones, which change from day to day. And depending on what day you sample it, they may be higher than others. But even if you take, so one of the hormones that we look for is called an FSH, which is the follicle stimulating hormone. And it's the hormone that the brain pumps out to the ovaries to say, come on, guys, let's get cracking, let's release an egg. If the ovaries are feeling a bit sleepy, then the brain's got to work a bit harder to get it going. So it might pump out a bit more. So a high level of that hormone indicates that you might be perimenopausal, and if it's very high, then it indicates that you're postmenopausal. But you can still have sleepy ovaries that aren't functioning properly, and a normal FSH. So it can be really confusing. It can be confusing to doctors and confusing to patients. And every cycle, you could do the same blood test on the same day and have different results.
Yeah.
So it's tricky. And the other tricky thing is that so GPs who aren't used to interpreting hormone blood results get them back from the lab, and they come up with a normal range. And of course, that normal range is for every adult woman, including the 80 and the 90-year-olds, as well as the 20 and the 30-year-olds. And so because the normal range is so vast, it doesn't tell them what's normal for a 45-year-old woman, for example. So it's just a bit of a minefield.
Yeah, it's really nice actually to have a doctor that really understands menopause, because it can be really tricky to for women, I think, especially now, which is quite amazing because everybody goes through the menopause. Some people sail through it and other people have a lot of difficulties. But it is so lovely, Naomi, to have literally a doctor that knows. I think so many women are coming unstuck in this area. So thank you. So there's a link between the bone health and menopause. And we all know that as we age, we should really be looking after our bones. Could you talk to us a bit more about that link and kind of the osteoporosis and things that can happen?
So estrogen is very important in keeping bone density. So your bones look a bit like the inside of a crunchy bar. They're made of a matrix that keeps them light but keeps them strong. And then they're constantly being reformed, remodeled, remade. It's not a kind of static substance. It's being formed and changed all the time. And when you lose your estrogen, what happens is that you get more bone breakdown, but you don't get the bone being made again, so they can get thinner and thinner and thinner, and then eventually break. And that's what osteoporosis is. So it's women seem to be susceptible to the sudden drop in estrogen. It seems to be like estrogen is protective, but when you lose it, you quickly lose your bone density, whereas men don't have that because they've never had estrogen like we have. So it is really important to think about bone health always. So in terms of diet, in terms of exercise, in terms of D and calcium, and avoidance of lifestyle factors that cause bone thinning, things like smoking and alcohol. So we just have to be bone aware, because hundreds of years ago we didn't live beyond the age of 45, so it didn't really matter. Whereas now, we're living into, to being 100. So you might have half of your life without your estrogen. So it's really important to be aware. And osteoporosis, it's not a frightening title to a lot of people. So they don't worry about it, but actually it causes a huge amount of morbidity and mortality. It's just not headline grabbing, because people who look like they have osteoporosis often look kind of old and crumbly. And so when they are hunched over and they fall over and they break their hip and, go into hospital and get a chest infection and die, everyone's like, well, they were old. But actually they wouldn't have looked like that if they didn't have the osteoporosis. So it's really, really important, and just probably not talked about. It's not talked about enough as a subject, because it's preventable.
Mm-hmm. Yeah. And a lot of women may not be thinking about it until they're actually sort of going into menopause, but really it's something we should be looking at a long way before that.
Mm-hmm. Always, yeah. They might not realise until they bend over and they crack a rib, or they stub their toe and they've broken their foot, and then it's a healing process rather than a prevention process.
Yeah. So what do you feel in terms of nutrition and lifestyle measures? Why do you feel that it's so key for women in perimenopause and menopause from a GP standpoint?
Because you can't expect, so if you can take HRT, you can't expect HRT to just fix everything. You can't trick the body. You still have to work with the tools that you provide it. So if you're not providing it with really good, well-balanced nutrition, or exercising it like it needs to be exercised, you can't expect the best out of it. It's just as simple as that. We just can't get away with it. You can't get away with treating your body like you may have done, when you were a student, or in your 20s, or even in your 30s. And I think they go hand in hand. And some women want to take HRT and some don't. But whatever your decision, you can't get away with. You're very, very, very lucky if you get away with abusing your body and it's still working for you long term.
Yeah.
Yeah.
And I know you're so supportive in the clinic and the work you do in terms of the right nutrition and lifestyle measures, which is brilliant.
It makes people feel better. It works, doesn't it? It
really
works.
And I think that nutrition and exercise are the most unprescribed drugs, because honestly, if I could kind of turn back the clock, I wish I would have started looking after myself younger. So if there are any younger women listening tonight, start now.
Yeah.
Start looking after yourself now.
It does work. It really does. I mean, exercise, it's vital for everything, not just your physical health, your bone health, but also your brain health and mental health, metabolism. I mean, it's everything really, isn't it?
Yes, absolutely.
So thank you so much, Naomi. We're going to, that leads us really nicely in talking about nutrition and lifestyle. And then we'll come back to you, Naomi, at the end when we go through some questions.
Okay,
so thank you. Thank you. That was brilliant.
Thanks, Naomi.
So we're going to talk about nutrition and lifestyle now. We should have some slides to go with. Fantastic. So having a well-balanced approach to nutrition and lifestyle can really help with your menopause and your future health. And we're going to be discussing what the right foods are to really help with fatigue and help boost your energy levels. And as Naomi said, there's so much fluctuation during the menopause and the perimenopause that we really need to make sure we have the right nutrition to support us through. And also, it's really important to maintain a healthy weight. And I know it may feel harder to achieve this as we age. So we're going to be talking about blood sugar levels and why they're really important with your hormones. So having balanced blood sugar levels is vital for your overall health and your hormone health. And I think we've all become so used to grazing all day, and we often live in this cycle of sugar highs and lows. And what happens is when we eat lots of processed food, which is particularly high in sugar, we get a sugar hit, and this is often followed by a low. And this happens when our blood sugar drops again. So some of the symptoms of blood sugar imbalances are things like energy highs and lows, and sugar and carbohydrate cravings, inability to fall asleep and stay asleep, an afternoon slump, and moodiness and anxiety. And I'm sure some of those symptoms will resonate with people who are listening this evening. So if you have too much insulin in your bloodstream, this can have an impact on your hormones. So we're going to be looking at ways to stabilize your blood sugar levels through your diet.
So there are some really simple hacks that we're going to give you tonight to kind of see you through. So try and limit your refined carbohydrates. So think about your white bread, your white rice, and your sugary cereals, and try and swap them for the low glycemic options. So these will really help you to maintain blood sugar balance. And I always have a rule of thumb: if it's white, try not to bite. Okay, so this will include your complex carbs. So you want to up your whole grain bread, your brown rice, your pulses, your sweet potatoes, and your vegetables. And there is a Mediterranean diet that is a really good model to follow. And that's a lot of fresh fish and olive oils and lots of kind of vegetables. So as well as eating complex carbs, really try and include healthy fats. So healthy fats you get from avocados, nuts and seeds, and fiber. So having a really good variety of fruit and vegetables, oats, flax seeds, and chia seeds, especially at breakfast, will really help to keep your blood sugar stable from the start of the day. If you are a coffee drinker, try and drink your coffee after you've had some food and avoid drinking it on an empty stomach. Also, eating in a really calm environment, sit and chew your food properly. They say to chew your food about 30 times. That's quite a struggle. But the best thing that you can do is actually to put your knife and fork down in between mouthfuls. And this will help you to feel actually satisfied, and it really helps you not to overeat. So there's something called protein pairing, which we talk about a lot. So that is when you pair a carbohydrate, so say an apple, with some nuts. So you eat them together. So you have a little handful of nuts and an apple, and this slows down the release of sugar into the blood. So if you are prone to reaching for your chocolate bar at like 3-4 o'clock in the afternoon, try swapping it for this combination. This will really help you to balance your blood sugar level, and it will help you to feel more energized.
Okay, so let's move on to why it's important to increase your plant foods. So you may have heard of the term "eat the rainbow," and this is a bit of a buzzword at the moment. And you may have seen sort of lots of hashtags "eat the rainbow," etc. on social media. I mean, we've also always been told to obviously eat your 5 a day, but we really actually should be aiming for more like 10 if possible. And I know that sounds like a lot, but it is actually a work towards goal to try and increase more fruit and veg in your diet. We should always eat vegetables in higher proportions to fruit. So it's really important to get an assortment of different coloured fruit and vegetables, because actually that's what feeds our healthy gut bacteria, and it gives us more fibre. And that's really important because it will help with the elimination process and it supports our liver function as well. So research shows that actually eating 40 different plant-based foods a week really helps to support your gut microbiome. And that is something that we're going to be talking about in a bit more detail later. So those different coloured fruit and veg, what they do is they deliver different health benefits. So for example, if you have red fruit and veg, it delivers things like vitamin A and C and manganese and antioxidants like quercetin and lycopene. Whereas your green vegetables and fruit, they deliver things like vitamin K and B vitamins and folate and potassium and antioxidants, which are vital for energy, bones, and detoxification. So this is really why we're saying eat the rainbow, because each different color will deliver different nutrients. And I think we often get stuck with eating the same things day in and day out. So if you can, really think about the variety in your food and what you're eating.
So 40 different plant-based foods sounds like such a lot. So what you can do to optimize that as well is, you know, they have all different types of apples. So you've got your Gala apples or your Granny Smiths. You can switch them up and they actually count as your different your different fruits, sorry. So that's a really easy way to kind of up more fruit and vegetable intake. So I'm going to talk a little bit about omega-3s because we know that they're really important. And it's really important to eat oily fish twice a week. And it's really good for your health and it's good for your brain health. So there are 3 types of different omega-3s. So there's ALA, EPA, and DHA. And they all do something different in the body. So overall, omega-3s are really anti-inflammatory, they support your hormones, they promote good brain health, and they help to boost your moods. So other than having kind of smoked salmon, there are other oily fish like sardines, mackerel, anchovies, and herring, which are really good to add into your diet. And for those people that don't eat fish, you can get your omega-3s from vegetarian sources like walnuts, chia seeds, flax seeds, kidney beans, and leafy green veg. So there is something called the omega-3/6 balance, and it's really important to point this out. So whilst omega-3 is generally considered an anti-inflammatory, the omega-6, which is often found in our more processed foods like our crisps, our biscuits and cakes, the ones that everyone kind of reaches for, these can be quite inflammatory to the body. And unfortunately, our Western diet is high in omega-3. And this can be the cause of increased inflammation and weight gain. We often suggest supplementing with a good quality fish oil to help improve our brain health. And this also helps to create and maintain healthy cell membranes and synthesizes our hormones. So it is really important. So I think omega-3s are on the top of our list, aren't they, Debbie?
Yes, definitely. So let's move on to gut health. And gut health and having healthy gut bacteria is really become a hot topic in recent years. And I'm sure many of you have seen an explosion of probiotic foods in the supermarkets and supplements on the shelves, and they're all really widely available. So what happens in our gut has a direct effect on our health, and our guts are actually home to something like 40 trillion bacteria, fungi, and other organisms. And when these work symbiotically, they really make a healthy gut microbiome. So the gut microbiome plays a huge part in shaping our appetite, allergies, metabolism, and neurological functions. And there's actually certain neurotransmitters like serotonin, our happy hormone, which are actually made in our gut. And this has a direct impact on our susceptibility to depression and anxiety. Our immune system also really relies on a healthy gut. So if our microbiome is imbalanced, this may affect our immune system as well. So every time we eat anything, we're feeding something in our gut. And this is why it's really important to have a balanced diet. So we feed our good bacteria. So what may happen is often the bad bacteria feeds off sugar and unhealthy fats. So we want to try and avoid those if possible. Gut bacteria thrives on fiber. So we want to have lots of that in our diet. Many people don't reach the recommended amount, which is actually 30 grams per day.
Yeah. So what can we do to help to maintain a healthy gut? So start by steering clear of unnecessary medications and environmental toxins. I know it's not easy for everyone and it's not in everyone's budget to try and eat organic, but eat organic where possible. And also think about what you're putting on your skin, what you wash your hair with, and opt for cleaner products with less chemicals, as these can also have an impact. Eating fermented food really increases the beneficial enzymes, B vitamins, and numerous strains of probiotics. So it's things like kimchi, sauerkraut, kefir, miso, and apple cider vinegar. Always have organic and with mother, and a drink called kombucha. And these are really readily available now in all supermarkets. And these are well-known probiotic foods. So probiotic supplements should only be used once your gut is in optimum health, as taking the wrong strains can actually cause further bloating and more gut issues. So there's stuff called prebiotic foods as well, and this stimulates the growth of good bacteria in the gut. So these are equally important. So examples of these are garlic, onions, asparagus, ginger, cabbage, beetroot, bananas, blueberries, and apples. So there's quite an array there. So you need to feed your prebiotic and your probiotic to have a healthy gut bacteria.
Yeah, and as you say, Lauren, a lot of those prebiotic foods are things that people are having in their diet anyway. So, but it's important just to pinpoint which ones they are.
And prebiotic foods like garlic and onions actually can cause quite a lot of stomach upsets as well. So if you are prone to bloating and gut issues, you can cut them out as well.
So let's move on to talking about alcohol and smoking. So when looking at ways to improve healthy habits and having a better menopause, we really do need to mention the impact of alcohol and smoking, not just on your menopause symptoms, but also on your future health. So apart from the obvious risks of smoking, it may also increase hot flushes and your risk of osteoporosis. And in terms of alcohol, we're not just talking about the occasional glass of wine, which is absolutely fine, but we're really talking about people having lots of units a week and drinking on a daily basis, because that is associated with an increase in hot flushes and sleep disturbances for many women in menopause. So that's something to think about when you're going through perimenopause and menopause.
So let's go on from drinking to talking about stress.
Yeah.
So stress is such an enormous topic when it comes to our health. And it really is a well-known driver for so many of the disease processes. So cortisol is the hormone that is produced by our adrenal glands, and it's secreted when the body is stressed. We needed cortisol to run away from perceived threats in the past. However, modern day living means that we're more stressed now than ever, and especially in this last year with the pandemic. So when we're stressed, cortisol takes priority over all of our other hormones, and we find ourselves in this perpetual kind of flight or fight situation. So there are really few easy, simple techniques to combat stress. So we often talk about a 2-minute breathing technique that you can do anywhere. So you can do this in the car, or on the train. If you're waiting to pick your kids up from school, it is literally just taking the time to breathe in for 5 seconds and out for 5 seconds 5 times. And this relaxes your nervous system and it changes our state. Taking a walk in nature, even if it's for 10 minutes, is such an amazing stress buster. And exercising is really good for releasing endorphins, and it is one of the most under-prescribed drugs, like I said before. So yoga, Pilates, and meditation, even for people that have never meditated before, there are a few really, really lovely apps like Calm and Headspace, and they're really effective and easy to use. So we've all been kind of a little bit devoid of connection, but we all know that connection with friends and family, and especially with community, is really important. So just picking up the phone, making sure that you've got somebody to talk to and to talk through things with. And also, if you are feeling a little bit wobbly, go to your doctor. Saying no and having really firm boundaries is quite difficult for a lot of people, but this is a really good way to kind of ground yourself and relieve stress. And grounding is another great stress buster. Literally take your shoes and socks off and stand. The weather's getting nicer now. Take your shoes and socks off, go and stand in the grass for 2 minutes in your bare feet and just let the electrons from the earth. It really works. If you don't believe me, go and try it in the morning.
We'll all be trying that tomorrow. Thank you, Lauren. So let's move on to talking about sleep. And when we work with our clients, it's not just all about nutrition. It's really about lifestyle habits, and they're really equally important, and they play such a crucial role in that menopause journey as well. So it's about quality and quantity of sleep. And as we age, we find that the quality of our sleep can be much lighter due to our fluctuating hormones, that we may have more night waking and we can have night sweats, and all these things really impact our quality of sleep. So just a few simple pointers that you can try. It's really important to make sure that the room is dark. And also we often say to clients, try wearing some blue blocking light glasses. And these can help if you are on your electronics before you go to bed. This can really help because that tends to stimulate and interrupt your sleep. So those blue blocking glasses are widely available on the internet. They're really good to try. So what you want to be aiming for is 8 hours sleep per night. That is the ideal. And we know that when we have a good night's sleep, we're more likely to have more energy, less feelings of brain fog, which is such a common symptom of menopause. And we also make better food decisions because we're not looking for that quick fix. So we would really advise to sort of focus in on improving your sleep.
Yeah, it is really key. So exercise and movement, and we all know that exercise is really good for us. But as we age, it's really, really important, like we said before, not to push your body like you did in your 20s. So if you've never run before and you decide that you're going to take up running, start off really slowly. And mix up your cardio exercises with stretching and relaxation. So there are so many benefits of exercise as we go into menopause, and it helps our heart health, and it helps to reduce the cholesterol levels. And also it will really help to stay at a healthy weight. So doing weight training and resistant bands is really good for bone density that we were talking about before. So as we go into menopause, we start to lose muscle mass, and this increases the risk of fractures and falls. So please remember, start slowly. We always say this, don't we, Debs? If you've never run, don't start thinking you're going to run the marathon next year. Just easy does it, and just build up very, very slowly. If it's a 5-minute walk, just to get yourself out into the open air. And we know, as always, there's been a lot of information that we've given tonight. And just remember that small steps always lead to great changes, along with consistency.
Yeah, absolutely. Thank you so much. I mean, we did miss that initial introduction to Dr. Naomi Potter and to us at The Natural Plate. So thank you so much for listening. You can follow Lauren and I at The Natural_Plate. We run online courses for women in perimenopause and menopause, as well as doing private consultations. So I think we're going to open the floor now and we're going to answer some questions. So if we can have Naomi is back with us.
Hi.
Hi.
So one of the questions we've had is, what can we advise for night sweats? What's, from a nutrition standpoint, what can we advise for night sweats? Lauren, do you want to start with that one?
So, I mean, there are things like sage. Obviously, reducing stress is really key. Taking supplements like sage or black cohosh. Remember that if you are on medications, you always have to check contraindications. And really, it is reducing stress, maybe doing meditation, you know, but you are also looking at low estrogen. So, I mean, from a nutrition standpoint, I would say make sure that you're eating clean, reducing stress, and exercising.
I think the other thing with nutrition is just to sort of maybe hone in on any possible food triggers. So for some people that could be dairy or gluten, and that could exacerbate it, or alcohol, as we also mentioned. So it'd be really good to sort of, you know, hone in on any of those and try and eliminate them. If you know, spicy food can often be a trigger for hot flushes and night sweats. So I would look for any correlation with those as well. And we've had
warm coffee after food. What harm on an empty stomach? Okay, so caffeine, really, if you are going to have a coffee, please have it after you eat. So coffee, a black coffee or a white coffee is quite harsh on your stomach. It's a bit like drinking alcohol on an empty stomach, okay? It is harsh. It is also quite dehydrating. So we always say, when on waking in the morning, try and drink water. That really helps to rehydrate your colon, and it really helps you to go to the toilet as well. So it is very stimulating, caffeine, and it can bring on hot flushes. So just try and stick after dinner, after breakfast even, and not after dinner.
We've had a really nice question. You mentioned it's good to get 8 hours sleep. Yes, that would be lovely. Can you give any tips of how to achieve this? I mean, I think definitely making sure that your room is dark is really, really key. I think trying to stay away from electronics 2 hours before bedtime, and I know that can be tricky because we all like to watch Netflix or whatever that we want to do, but actually the blue light, as I said, has a very stimulating effect. So I would try and avoid electronics, and also, you know, avoiding alcohol as well, because that can be quite stimulating, and caffeine, that's an obvious one. Anything else you want to add, Lauren?
No, Naomi, what would you add to that from a GP standpoint?
There's a lot to be said for sleep hygiene, isn't there? And just making sure that, as well as kind of avoiding stimulants and things, that when you need to go to bed sleeping. So one of my colleagues, one of my associates, Zoe, is a sleep doctor, and I've done a few really interesting chats with her that were really kind of enlightening. It's you know, most people think that you go to bed even if you don't feel sleepy, and you must be in this routine where you're in bed and you are going to go to sleep, but she's got some really amazing tips about you only go to bed if you're sleeping, and whatever happens that night, you set your alarm and you get up in the morning, even if you are absolutely exhausted, and you push on through, and then you go to bed tired that evening. And if you're in bed and you're lying awake and you can't sleep, you get out of bed and you go and do something until you feel that urge to go to sleep, and then you go back to bed when you're ready to go to sleep, and you don't spend hours lying in bed awake associating being in bed with being awake. You need to associate being in bed with being asleep.
Wired and tired feeling, isn't it? You know, where you're kind of really wanting to get to sleep. That's a really good tip, actually.
Yeah, it's I think it's because you can have symptoms. So there's a lot of menopausal symptoms that can cause sleep disruption. So things like anxiety, palpitations, night sweats. But even when those have gone, you can be left with an insomnia, which is like a behavioural difficulty with sleep that doesn't have a physical cause, but it's because you've got into kind of bad sleep hygiene. So there's loads of things that you can do, but it often takes kind of an awareness as to what the things that you're doing are wrong and how to break those bad cycles.
Brilliant, thank you.
We've had another question. What are the key supplements to take? So that's quite a general question, and we do need to be mindful of what medications people are taking because of interactions. But obviously, the obvious one is vitamin D. It's really, really important to take well, you can take it all year round, but it's particularly important between October and March, obviously, when we don't have any sunlight whatsoever. In terms of recommended doses, I think the NHS recommends 400 IUs, which is a very low starting point. That's correct, isn't it, Naomi?
That would be a kind of very baseline.
But you can go. But I think what's really important and where we come from is to actually test your base level before you start to supplement, and then you can really see what level is appropriate for you, and you can do that by getting a simple pinprick test and working out your levels first.
So we always say food first. So try and have a really balanced diet before taking supplements. I think there's this thing that people kind of think that supplements don't work. They really do, and they should be used with caution. And as Debbie said, and as we keep saying, you have to check interactions, because things like omega-3s are absolutely amazing. But if you are going into hospital or you're having an operation, you have to come off 10 days before. So you have to be really, really mindful.
Yeah. Is there any more questions, or have we covered them all? Okay. Naomi, do you want to talk a bit about where people can find you in terms of what you're doing?
Yeah, so I have quite a big Instagram platform, which is at Menopause Care, and I've done a series of little videos. They're only about 2 or 3 minutes long, just kind of covering a lot of the topics that people find really confusing. So there's like what to ask your GP, what is HRT, what is the perimenopause, what are symptoms, that kind of thing. And I've done a series with Lisa Snowdon on all sorts of menopause things. It's quite a nice light-hearted look at all things menopause. And then my website's also got quite a lot of information there. It's kind of categorized under symptoms and treatments and that kind of thing, which is, at the moment, it's drnaomipotter.com. The name's going to change in a minute, but at the moment that's what it is. But you could Google my name, it comes up anyway.
Brilliant. Thank you, Naomi.
Thank you.
Thank you for sharing your knowledge with us tonight as well.
Thank you for having me. Thank you for inviting me.
So thank you everyone for watching. We hope you found this really informative, and we've loved sharing information with you, and we look forward to seeing you at future events. So thank you for watching.
Thank you,
everyone.
Thank you. Good night, everyone.
Good night.
Thank you.